Hey there, today I'm going to break down a topic that might seem a bit complicated at first, but don't worry, I've got you covered. We're talking about dialysis. Yep, that thing you've probably heard about but never quite understood. Let's dive right in. So, what is dialysis? Simply put, dialysis is a treatment that takes over the job of your kidneys if they're not working properly. Your kidneys are like the body's natural filter, getting rid of waste and excess fluids from your blood. When they can't do that job anymore, dialysis steps in to help out. There are two main types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, a machine is used to filter your blood. You go to a special center, usually about 3 times a week, and your blood is drawn out, cleaned by the machine, and then returned to your body. It's a bit like having an external kidney doing the work for you. Peritoneal dialysis, on the other hand, uses the lining of your abdomen to filter your blood. A special fluid is put into your belly through a catheter. It absorbs the waste and then it's drained away. This can often be done at home, which gives you a bit more flexibility. Now you might be wondering, why would someone need dialysis? The main reason is kidney failure. This can be caused by conditions like diabetes or high blood pressure that damage the kidneys over time. When the kidneys can no longer do their job, dialysis helps to keep the body in balance by removing the waste and extra fluid. It's important to remember that while dialysis can help you feel better and live longer, it's not a cure for kidney disease. It's a form of treatment that supports your body while you wait for a kidney transplant, or if a transplant isn't an option. Dialysis can be a big adjustment, both physically and emotionally. It's normal to have lots of questions and feelings about starting treatment. Talking to your healthcare team and connecting with others who are going through the same thing can be really helpful. Alright, that's a quick rundown of what dialysis is and why it's needed. If you have any questions or if there's a specific term you'd like me to explain, drop a comment below. Your curiosity is what keeps these videos going, so don't be shy. Thanks for watching, and remember to like, subscribe, and hit that notification bell if you found this video helpful. Catch you next time. Now, let's talk a bit more about the process and what you can expect if you or a loved one needs to start dialysis. Before starting dialysis, you'll have a minor surgery to create an access point for the treatment. For hemodialysis, this is usually a fistula or graft in your arm. This access point allows the blood to flow to and from the dialysis machine efficiently. For peritoneal dialysis, a catheter is placed in your abdomen. It's important to keep this area clean to prevent infections. Hygiene and proper care of the access point are crucial to avoid complications. During the dialysis session, you'll be monitored by healthcare professionals to ensure everything is running smoothly. Many patients bring books, tablets, or other activities to pass the time during treatment. It's common to feel a bit tired after a session, but this usually improves as your body adjusts. Diet and fluid intake are also important aspects of managing kidney disease and dialysis. You'll need to follow a special diet to help control the buildup of waste products in your blood. Managing your fluid intake is crucial, as too much fluid can cause complications. Emotional support is just as important as physical care. Joining a support group or talking to a counselor can be very beneficial. Setting personal goals and maintaining a positive outlook can make a big difference in your overall well-being. Celebrate small victories and progress, no matter how minor they may seem. Remember, you're not alone in this journey. Lean on your family, friends, and healthcare team for support. To recap, dialysis is a life-saving treatment that helps manage kidney failure by filtering waste and excess fluids from your blood. With the right care and support, many people on dialysis lead fulfilling lives. If you have any more questions or need further clarification, feel free to leave a comment below. Your engagement helps us create more informative content. Thanks for watching, and don't forget to like, subscribe, and hit that notification bell to stay updated. See you next time.